Hello, Kidney Warriors! James here from Dadvice TV, and this is Dadvice TV Live. And if you're new, welcome. This is a live show. You get to interact, post comments, post questions, like Steven right here who's new. Awesome. If you are new, go ahead and introduce yourself in the comments. We have a great community here at Dadvice TV that is very positive, very helpful, and very supportive. And if you're new, let me introduce you to me. My name is James. I'm a kidney health coach here at Dadvice TV, and I have kidney disease. I was diagnosed with stage 5 kidney failure in November of 2018, almost 2.5 years ago. And I was told I needed dialysis or a transplant. And, oh, that broke my heart. Well, the good news is I was able to improve my overall health and my kidney health, and I have not gone on dialysis, and I have not gotten a transplant. I've worked on my diet, worked with a renal dietitian. That's super duper important for kidney patients. I got my blood pressure under control. I'm walking, I'm exercising, I'm losing weight, and I am feeling great. Now, I am stage 3 chronic kidney disease, but more importantly, I don't have any symptoms. I feel great, and kidney disease is not holding me back. And speaking of that, we just have a few days left of a promotion I'm doing called Kidney Disease Can't Stop Me, the Share Your Victory giveaway. Go to dadvicetv.com, the website, and there is a link to enter this giveaway. And it's really, really simple. All I'm asking you to do is post a picture of yourself not letting kidney disease hold you back. It could be you out running. We got someone who ran a 5K and a 10K marathon just 4 months after starting dialysis. We've got people enjoying lakes, their cabins, making dinner, exercising, dancing, all sorts of great things. Just showing that, hey, you don't have to let kidney disease hold you back. Now, tonight, we are going to be talking about something that's going to pretty much, get pretty close to home for everyone out there who has a chronic illness. We're going to be talking about the importance of recognizing the hidden symptoms, the invisible symptoms of chronic illnesses like kidney disease. And kidney disease is in itself pretty much an invisible disease. You may look at me and say, James, you don't look sick. Most of you guys out there have been told that you don't look sick. But deep down inside, yeah, we are sick. And there's some things we have to deal with that it takes a lot of effort. And that's why we're called warriors, to deal with those and kind of keep them hidden. Now, to talk about this, because this is a problem or it's a challenge that hits every kidney patient, let's welcome back for her second time on the show, but not her last one. She's going to be here twice a month, Lana Life. Hey, Lana, how you doing?
Hi, everybody. Happy to be back. Thanks for having me.
Now, tell those that are new a bit about yourself.
So, again, my name is Lana Life. I'm a licensed clinical social worker and therapist here in the great state of Hawaii. I have worked in ICUs, I've worked in nursing homes, I've worked at a nonprofit kidney disease foundation. I know the wonderful Jen, the renal dietitian that we have here. And I've spent a lot of time in healthcare, getting used to, the ins and the outs, the challenges people face, and most importantly, just really learning about their unique stories and helping them get through really, really difficult parts of their lives. So I'm happy to be here to share some of that and to get to know all of your stories as well.
Awesome. And you're going to get to know so many of our regulars here, like Ray. Hey, Ray. And his mom over in the UK. A little late there, but Ray doesn't miss a single show. I think he's actually at the gym right now working out, which is fantastic. I need to be doing that. I got my treadmill and I use it. Not enough, but I'm using it. So today we're talking about the importance of treating the invisible parts of an illness like chronic kidney disease. Can we start kind of at the beginning? What are invisible illnesses, and how do we know we have them?
Yeah, so Oftentimes we see people, who may have a cane or who may have a wheelchair, and we're like, well, they have an assistive device. They must have an injury. They must have a condition. I can tell that they are, quote unquote, for lack of a better term, sick. But for more than 125 million Americans who live with at least one chronic condition, and then the more than 40 million who have a condition that do not use an assistive device, but are disabled in some way, these are the people that are left out. So roughly 7 million people will use a cane, walker, wheelchair, some type of assistive device. So putting that math all together, right? If we have 125 million people who have a chronic condition, we have 40 million people at least who have some type of, functional mobility or some type of pain or challenge with it. That's a lot of people that we don't see living with these chronic conditions, and it just seems like everything's okay, when that's actually not the case. So for people living with an invisible illness, that's things like the pain and the fatigue that we may experience, the muscle cramping. It's all of these experiences that we have that we don't appreciate because we can't see outwardly. So when we don't see somebody with an assistive device like a walker or a wheelchair, we just automatically assume that everyone's okay, and that's not true.
Yeah, and that's not to make it sound negative, but most of my relatives that I meet, they think I'm perfectly fine, that I'm okay. Mm-hmm. Now, they saw me when my kidneys failed, and I didn't look very good. My eyes were so dark and sunken, but now that I'm eating better, being more active from the outside, and I'm very proud of this, I look like I'm doing great and I'm feeling great. But inside, I still have bad kidneys. And, if I go someplace and I overexert myself, I get tired easier. I like to think a little bit of it's age as I've gotten up there in my experience. But it is, it comes down to my kidneys. I do have some of that invisible stuff that you can't see. And, people don't always understand it.
Right.
They may think I'm just being a little lazy or didn't want to do something, when no. I'm really fighting something on the inside.
Right. And that's an unfortunate experience that I have encountered a lot of people who have had, and I've bared witness to a lot of that, both in my personal life and in my professional career. And it doesn't help anything. It actually minimizes what people who are living with a chronic condition such as chronic kidney disease are experiencing, and it leads to increased isolation. It leads to, feelings of depression, being misunderstood, and it's just really hard to overcome that, especially when these people, are supposed to be here to help us, supposed to lift us up, and these are some of the things that we're hearing.
Yeah, and now I'm going to ask the audience out there. As kidney patients, whenever we tell people that we have kidney disease, a lot of people offer advice to us, or they make comments, and they don't mean to be mean or cruel or not understanding. There's a lot to learn about kidney disease, as we've all learned by being patients. I'd like you to post in the comments some of the things that when you've told people you have kidney disease, what are some of the things that they've said to you, not meaning to be mean, but either, as some type of support, or how have they reacted to, fatigue or the other issues, these invisible issues that you've had once you've explained to them that you have kidney disease. Go ahead and put in the comments. I'm going to share the most common one. I hear this. Now we have COVID. I'm not out every day. But pre-COVID, I heard this advice every single day because I was out telling people, spreading the word. Hey, I got bad kidneys, or if I was at work presenting to a class or a group of people, I'd mention, hey, I've got kidney issues. If you want to learn more about it, check out my website. I was kind of promoting it. But I would always hear, have you tried drinking cranberry juice? and I think most of you out there, and I've seen it in message boards too, on medical boards, or someone will say, hey, I've got bad kidneys. They're in a general forum, and people are recommending, have you tried cranberry juice? So I would love to hear from others. What have you guys been told? I know the people who recommended that don't mean to sound like, hey, they're belittling my kidney issues, and they honestly think they are helping, and maybe that is something that I haven't thought of or tried. But oh wait, someone said that. Warren says to drink more water. Yes, drink more fluids. I hear that one too. And Abby even, this is a great one. People who talk about kidneys don't think it's a problem. And, or they think you can just go get a new kidney.
Right.
And, if the time comes that anyone out there needs a kidney, you can't just call up Walmart or Target and have it brought out to your car when you pull up to the parking lot or anything like that. It could take quite a long time.
Absolutely.
Yeah, Laura's saying she mostly ignores the advice. Oh, yeah. I'm looking at some of the comments here. Very good. So we've all heard those things, that it can't be that bad. If you just do X, Y, Z, if you just drink more water, if you just drink some cranberry juice, you'll feel better. It'll go away. And as a kidney patient, those right there have an emotional cost for us. Kind of, they take a toll on us. Like, no, I can't just drink cranberry juice and my kidneys are better, or take some magic herb. You hear about all of them. Have you tried CBD oil? Have you tried this? You tried that? We get everything, but there's an emotional toll on that, because it almost feels as a patient that, and it's a fact, we're being misunderstood. And how do you help people with that, or what do you recommend for that?
So, a lot of times it really is just like adding fuel to an already raging fire, and it almost leads people to believe that you're not doing enough to take care of yourself. Even if that's not the messaging that our loved ones or our doctors are intending to share with us, that's how a lot of times we walk away feeling is, well, maybe I'm not doing enough. This is my fault. And that's not true, and it's not helpful. And so a lot of times we just get stuck, and it leads to feelings of isolation and guilt, like I shared. One thing that we see a lot of times is undiagnosed depression and anxiety. And so it's difficult to diagnose people with depression and anxiety who have chronic conditions such as chronic kidney disease and end-stage renal disease, because so many of the symptoms of depression and anxiety are similar to what you would experience, with kidney troubles. So things like changes in mood, appetite, sleep, all of these things that, we do see with our kidney patients that also can overlap into, the mental health part of things. So a lot of times that stuff does go undiagnosed, unfortunately.
Yeah, there's lots of great comments, and Teresa just made a great one. Nobody knows what we're going through on the inside. That is so true, and that kind of gives us, and trying to think of the right way to say it. I'm a very positive person, but these comments that everyone's making, I too have to deal with these inside. People don't understand kidney disease, and if I think about it, it kind of makes you feel alone. Now I got this group here, all of you out there, Dadvice TV community watching. We support each other, but when we're not together like this, it can almost feel alone. And then that's when, if you let it happen, depression can start building up. How do I know when when I need to do something, when it's not just the normal stuff that's happening with the feeling alone or the starting to feel depressed?
So I do want to point out that the statistics, if you just Google them, like I'm sure, you guys do with, when you get the diagnosis, what does this mean? And there's a lot of scary information that's out there. So I just want to remind everybody that this information isn't meant to scare anyone. It's just for education because it's real and it really is happening. Between like 25 and 33% of people living with a chronic condition go on to have symptoms of depression. When we see people who have, let's say, end-stage renal disease, or we have people who have chronic kidney disease, this number is just so high. It actually goes, and I think it's probably underreported, but it can be over 50% of people who are living with depression and anxiety that they may not even know about. So when we have feelings of depression and anxiety, it can come between things like I said, changes in appetite. It can be not feeling as interested in things that you normally like to do. It can be, periods of crying. It can be just worrying. It can come in a number of different ways. And again, it's really, really complicated because these things can also be a result of, having the chronic condition. It can be a result of, limited mobility, the treatments, having to go to dialysis and, getting stuck with needles. All of these things really do impact our moods and are impacted by the moods. So when we start recognizing that these things are happening, the first thing most of us want to do is go to the doctor, right? Because we're recognizing that something's not right. And so we've found that it's really, really difficult, even for our doctors, to not necessarily recognize that it's symptoms of depression and just recognize, oh, well, it's par for the course. You're having, nausea and, not wanting to eat. Well, yep, that's to be expected.
Yeah, they kind of just chalk it up to, yep, you've got kidney disease.
Yes.
And sometimes they might need to dig a little deeper to find out, no, that's not because of kidney disease.
Right.
The kidney disease is related to it in a way. Maybe it's the cause of it, but it's not because of the kidney disease, if that makes sense.
It does. And if you've had a history of depression or you've had a history of anxiety, and then you're diagnosed with a chronic condition like chronic kidney disease, that just increases the likelihood that there will be some depression, there will be anxiety, and all of these things are normal. When I was working in the ICU, I would always get these referrals. It would happen several times a week at least from, doctors and nurses, well-meaning, who would say something like, this patient is being medically non-compliant. I hate that phrasing, medically non-compliant. It makes my skin crawl. But what they would be wanting me to do is go in and, quote unquote, convince people to engage in treatment or, essentially berate people for not taking their medications or not following treatment. And this is another element of the invisible part of illness that I don't think we really truly appreciate and understand. So I would often go into rooms with people and it would never be laziness. It would never be, oh, well, I just don't want to. It would be things like, I live too far away from my doctor's office to, have regular appointments. I can't afford my medications, can't afford my copay, limited transportation. And so things like these get in the way of us being able to access treatment, being able to do the things that we want to do, and that just makes it that much more difficult. So hearing the phrasing medical noncompliance makes me absolutely insane, but it can also be another reflection of depression and anxiety as well.
And I'll tell you, I do a great job of taking my medication. After the scare of going into the hospital with kidney failure, I use an app, so I take it all right on time like I'm supposed to. But I'll tell you, it is difficult, and I am dedicated to not missing any because my morning medication, it really makes me feel not great for a few hours until about 1 in the afternoon. I am just fighting for energy, and that's when I'm working. I've got to have my energy. I've got to be on. I've got to be pop, doing things. And my work is very stressful and very, very busy. And there are times where I'm like, whoa, I've got quite a busy day. I can't take my medication this morning because it's just going to hold me back. And then I do worry, if I do take it, is that going to impact my performance with work? And that could lead to, hey, you're not keeping up. We got to replace you. And I don't want that to happen. Right. So even just something as simple as that, besides being too far away or the cost of it, just how it makes you feel is something that I personally have a challenge with. Now I'll take it. If I don't take it in the morning, if I decide, okay, I'm going to take it at noon or at 12:30, I go into the app and I set the reminder so that it will remind me and bug me so that I don't miss taking it. And I never miss taking them during the day, but I will move when I take my medication just because of how it makes me feel. There's one pill that I take, a little one in the morning, I take a little bigger one, the same one in the evening, that it's like a tranquilizer. It turns me into a zombie. And that actually is one of the things I deal with that kind of is, it's not depressing, but it's kind of depressing, is that I have that period of my day every day. I know it's coming. I know it's going to be here when I take that pill. And in March, which is coming up soon, I've asked my doctor, I want to change my medication. I want to get off that pill. I'm sticking with it, but I can't keep doing this forever. It's just, and so I'm reaching out for help. I know that is a problem. And in a way, for me, it is one of those invisible problems. Even though people can see it. My wife can tell on the weekend, she's like, yeah, it's 11 a.m. You need your nap. You just got up. And last week, I actually took a 4-hour nap. I took my pill and I slept for 4 hours during the day on Saturday. After I got up, it was like bizarre. Anyway, that's just one more example of that medical non-compliance. And I've heard that phrase before. So I'm very careful to make sure I take all my pills so that I can't harm my kidneys or myself by missing medication.
Yeah, I think you bring up a really good point, how it makes you feel, because we do have all of these treatments. We do have, all of these needles we can stick you with. We have all these medicines that we can give you, but we're not the ones who are having to take it. We're not the ones having to deal with those side effects. You are. And so I think a lot of times we recognize, this cluster of symptoms, and we're not recognizing the person and how this cluster of symptoms isn't impacting them, but also how the treatment will as well. And so it's easier just to say, well, they're lazy. They don't want to, take care of themselves. They don't want to take this pill that I'm trying to offer them. But it's a really, really intimate decision. It's an intimate routine that you have to engage in. It's not a one and done. It's something you have to experience day in and day out, for the rest of your life. And that's not an easy task.
Yep. Now, so much of this, when these issues happen, it does, and I want to guess that it leads to increased depression for those of us with chronic illnesses, because I kind of feel that way about my medication. If you guys want to talk about, getting iron in your diet, eating more vegetables, I get excited. My eyes get big. But when you want to talk about my medication, I'm not happy to talk about that because it has such a negative thing for me. I don't see my pills, even though they're all blood pressure medication. They keep my blood pressure under control, and I love that part.
Right.
But it's like a bad part of my day taking those pills, and it's something I really don't like to talk about. And when I'm there doing my pills in the morning, each one, there's a lot of them. There's a lot of pills. I'm kind of in a bad mood when that's happening, and I know, if I don't be careful, that will get me kind of depressed for the rest of the day, that I have to take these every day and how they make me feel. Are we seeing more depression because of these hidden symptoms in people with, is it, I guess the question is it increasing? Are we seeing it happen more often?
Yeah, and I think there's a couple reasons for that. I think the more education that we're providing to people about depression and anxiety and these hidden parts of, having these chronic, conditions and illnesses. So I think that there is more awareness out there that this is happening. But another part of it, I think people are starting to really normalize the fact that depression and anxiety happen, and they happen to all of us, even when we're feeling our best. And so I think people are really just getting the word out there. I think people are more open to getting this information, but I also think that people are feeling more comfortable in disclosing that they're having some mental health challenges, that, I'm just not feeling myself, like I'm taking these meds every morning. And sometimes it's hard. It's hard to think about having to do this every day for the rest of my life. As hopeful as we want to be, and as hopeful as we are, and as thankful as we are for these medications, it's okay, and it is absolutely normal to have those thoughts, cross through your mind. Absolutely.
Yeah. Now, let's just focus a little bit on depression, because a lot of people know, I had a friend last year who went through some serious depression, and I did not see it, the signs of it. His family did not see the signs of it. How can we recognize the signs in others? Maybe my illness could be causing some depression in a family member of mine, just because I'm not the person that they thought, or that I used to be, or not able to do stuff. How can we recognize this maybe it is a problem? And how can we help ourselves or someone else make that next step to reach out for help?
So I do also want to share, just for education piece, not to scare anybody, but, they had done some studies. They've done a lot of studies on, the increased risk for, suicidal thoughts. Not saying that they, want to, end their lives, or they want to do anything like that. They're making steps. It's just the thought that passes through their mind. One of the studies in particular, it was like 200 dialysis patients. 21.5% of them had reported having thoughts of suicide at some point. And 3.5% had planned an attempt, and then another 3.5% had attempted at some point during their lifetime. So I think what you are bringing up, the fact that this is something that you're experiencing, you're not alone. This is something that people do experience. Unfortunately, we see that there is an increased risk of this being a possibility. Doesn't necessarily mean that that's actually going to happen. But I think you bring up a really good point. So with that being said, in recognizing these symptoms in other people, if we are starting to see that our loved ones are just tearful, maybe withdrawn, they're not really wanting to connect with others, maybe you're noticing that they're being more stubborn. People always describe, well, my husband or wife, they're just being stubborn. They don't want to go to the appointment. They don't want to do X, Y, or Z. They're not really wanting to, sit and talk. All they want to do is sleep. These things, again, can be a side effect of, having chronic kidney disease and other conditions. But a lot of times this is what we see myself in my own practice in diagnosing someone with depression. It's a change in their mood, it's a change in the appetite, increased tearfulness, not being able to relax, maybe just worrying about a lot of things. And then, asking them, are you feeling okay? Are you having any thoughts of suicide? Asking someone if they're having thoughts of suicide, does not give them the idea. It does not give them the idea to do that. But then B, it's normalizing the fact that you're recognizing a change in them and that you are a safe person to go to if they are having those thoughts. So again, it does not plant the idea in their heads. That is a very common myth. But I do that in my job 40 hours a week. And it has never once given someone the idea. what it does is it opens that door to have a bigger discussion about it and say, I am not feeling like myself. Thanks for asking, thanks for caring. So opening that door. And if they are saying that they're having thoughts of suicide, then that's when we start talking about things like, do you have a plan? Have you, thought about what you would do, where you would go, things like that. And if you're concerned, call 911. Have them come and take your loved one to the emergency room and do an evaluation. You can call, if you're not around them, you can call a loved one and have them come sit with that person. And you can even call the crisis line. I did not include the crisis line contact information in my most recent blog post, but what I'll do is I'll send that to you. That way we have that number handy.
Yep.
And if you're ever not sure what to do, you can always call the crisis line and they can help you walk through, how to help your loved one, or if you're feeling a certain way.
Yeah. With my friend, longtime friend from when I was in, elementary school, I know if I would have reached out to him, I could have made a difference. I could have helped him. But I just didn't see the signs, which was, I wish I did. But that makes us, I now understand even more how impactful depression can be, because not only was it difficult for him in the choice he made, but it's hard. I know he didn't realize how it impacts other people.
Absolutely.
We still think about it. And his birthday came up and it reminded me, hey, it's Mark's birthday. It's like, oh, I had to remember that again. So I've made it a point to be even more aware of signs of depression, so that if I see that in other people, I can reach out. If there's anybody out there, you need someone to talk to, I'm here. I'm always here. You can go to my website, hit the contact thing, come through and say, I just need someone to talk to. Boom. I'm here, and I'll find somebody in your area if you need some help locally. There's a lot of support out there. And like you said, you shouldn't be ashamed or afraid to reach out for that support. It's a mental challenge. We are living with a heavy, heavy burden on our shoulders. And if we need some help from time to time, that's all right. It's out there. And it's out there because people need that help from time to time.
It's just like, if your blood pressure is high, you go to the doctor and you adjust, what you're eating, maybe take a pill to help with it. But you seek out and you get help to kind of correct what's going on. And mental health, unfortunately, it's an invisible part of illness, right? It's just viewed so much differently, unfortunately. And so I always try to liken it to, like I just said, if your blood pressure's high, you got a headache, you take something for it if possible. Or if it's, reading too much, on screens, avoid the screens. So I'm oversimplifying it a little bit, but it's the same thing. There are licensed professionals out there like myself. I'm a licensed clinical social worker, like I've said, who diagnose people with these conditions, and it's normal. Anxiety, I don't think a lot of people realize either, is an evolutionary trait. It's something that actually helped keep us alive back in the days of, cavemen and, when we were hunters and gatherers, because those who were worried, those who were afraid would adjust their behaviors. They would maybe not go out the cave late at night when tigers could be roaming around. Again, I'm oversimplifying, but but again, it's an evolutionary trait that is meant to keep us safe. And that's fine. It just becomes really difficult when we're not able to manage it or when we're feeling out of control. So it's okay to ask for help, and it's absolutely normal to do so.
Now, anxiety is one of those invisible traits that I notice a lot of in quite a few people with chronic kidney disease. What are some ways that they can better manage that or address that? I don't know what to tell somebody if anxiety is one of their challenges.
Anxiety is hard because it's telling us that there is something that we're worrying about. It's telling us that there is something that's not right. And trying to get through anxiety is difficult because that can lead to things like difficulty with concentration and focus. It can be, overcompensating. It can be, perfectionism. It can come up in a lot of ways that we may not even realize is anxiety. So the most important thing that we can do, among many, is to check in with our bodies. So for me, when I'm feeling anxious, I start to feel it in my chest a lot of times. So it'll feel like maybe I'm having short sips of air, like I'm breathing through a straw, which a lot of people, that's a very, very common way that their anxiety does show up. Other people, it might be sweating. It could be like flushed face. It could just be, not being able to sit down, thoughts just kind of racing, going all over the place. So the important thing is to check in with your body and put a name to it. So my chest is feeling a little tight and I'm having to sip, some air through a straw is what it feels like. That's my anxiety. And what's my anxiety trying to tell me? So in doing that, it kind of helps us to get back to the present moment and recognize, this is not me, this is just something I am experiencing. So taking frequent breaks, you can't burn the candle at both ends and not expect to burn out at some point in time. So knowing those limits and being respectful of those limits, and just taking breaks, more breaks than you think. There was this excerpt of this book that I read recently where they did this study in the 40s. They had these guys who were working at Bethlehem Steel, and they were loading this really, really heavy iron freight onto a truck. It was, I think, like 12 and a half tons of iron freight. And they did it over, constantly over the course of a few hours. And they were exhausted by noon, couldn't go any further. The next day, their bosses had told them, okay, load iron onto the freight trucks for 26 minutes, then take a 34-minute break. By the end of that day, they had rested more than they had worked, but they were able to actually load 40 tons instead of the 12 and a half tons of this heavy iron freight. So doing more rest than you think you need is actually going to serve you in the long run.
Yeah, that's a great example of how rest isn't negative. It can help you. And a lot of the times we do push ourselves too far at once before we will allow ourselves to get that rest. And in that example, you could push yourself just a little, get a little rest, push yourself a little and rest. And they probably felt better on a day like that, even though they did more work, more work was accomplished. They probably weren't as exhausted as they were the day before, since they did it in those little tiny chunks.
Right. I heard it likened to living, your mental health is like living paycheck to paycheck in your brain, where it's like, if you spend all of it, right away, then you don't have anything left until the next paycheck. And again, I'm oversimplifying, but it's if we are able to kind of break up our bills maybe a little bit to like kind of stretch it, that helps us, getting from one paycheck to another, without, always like overdrafting. Because when we overdraft, I mean, there's nothing left. We end up spending all this time playing catch up, and it's just not good for our bodies. It's not good for us in the long run. So just knowing your limits, recognizing that you are doing the best that you can, and you don't have to perform at the same level that you could last year, 5 years, 10 years ago, your neighbors next door, because everybody is on a different journey, and everybody's functional limits are going to be different, and that's okay.
Yeah, and that's probably one of the parts of kidney disease that most of my relatives and the people I engage with often have come to understand. They know, hey, most of them call me Jim. Jim's not going to be able to do as much, or spending a full day at Disneyland. It's not good for him. It's going to exhaust him. So we kind of work around those where, for example, I went to SeaWorld early last year before COVID, and I did stuff. Then I sat down, had a big old glass of ice water, My wife and kids went and did some stuff, did a few rides, watched a show or something, came back and got me. And I'm sitting there, I'm feeding the squirrels, watching the lizards. I got my energy back. And then I'm doing little bits, kind of like what your example was. I was taking breaks throughout the day, and they understood that I couldn't do what I used to do. I would have gone through everything. I would have hit every junk food stand there was and got my elephant ears, my fried Twinkies, everything. They knew I couldn't do that. And it, I wasn't ashamed of it. I didn't feel bad. It was like, hey, in a way, I got out of some of the boring stuff. I was like, yeah, you guys go do that. I'm going to sit here. And I do like roller coasters when I was thin. Roller coasters aren't fun when you're a big bone person. So when they want to do the roller coaster, like, yeah, you guys go do it. I'm going to rest. I got to use that a little bit to my advantage.
I think that's great, because what that does is that gives yourself permission to take care of your body, to listen to your body without that shame piece. But that sounds amazing, going to SeaWorld and, going to Disney and doing all of these things. I mean, there's a million directions that you can go and have a great time. Mm-hmm. So in doing things that I guess maybe you're the most excited about, so if roller coasters are not your thing, maybe not spending the time doing that, spending that time getting the rest, but going and seeing the dolphins was something you were really, really looking forward to. That's being mindful about how you're going to spend your time and your energy, and then that way everybody's having a good time, and you're not feeling like you're left out.
Yeah. Some of the audience, they like my big bone James.
I see it.
I'm not fat, I'm fluffy. You guys have seen a fat skeleton. I'm sure they exist somewhere. And all my clothes keep shrinking. What's going on? But in serious, those roller coasters are not designed for people like us. Us being, me, big. They're torture. So I use that to my advantage and got to do my rest. So I was resting and avoiding something I didn't like. So I got it like I doubled it up.
How did you communicate that with your family, or was that a conversation that you had ahead of time before you went?
Very good. That was way ahead of time. So we're planning our trip to Florida, and pretty much day by day, I knew I need to stay hydrated. It's going to be hot there. I'm not going to be able to get water everywhere, and I didn't want to be paying $6 a bottle of water and drinking like 8 of them in a day. So I had to prepare for that. So I made sure we understood, my kids and my wife, hey, I'm not going to be able to do all day. I can't walk, but that doesn't mean we can't go all day to SeaWorld. I'm just going to rest. So we kind of looked at things and we planned it out, and we're like, hey, this is a sit down event. We're going to go watch the dolphins. We're going to go do this. We're going to go do that. And then we looked at the map. We downloaded it online and started planning things. Like, okay, let's first, we're going to be there for a week. First day, let's just try to stay in this area so there wasn't as much walking to exhaust me. And I planned my meals, my snacks, my water, and they knew, hey, I might need to take a break. Don't feel bad leaving me behind. I'll sit down. I got my snacks. I got my phone. I'll stream something on Netflix with my headphones in. And I had to make sure they understood I am perfectly fine sitting there while you guys do some stuff. And if I can, I'll snap some pictures or something while you guys are doing it. Because I wanted to make sure they didn't feel bad that they had to sit there with me when I was resting. So we all had an understanding way before it happened. The first day, I did get overexhausted there. It was hot, the sun, a big guy in the sun. I'm cooking, I'm burning up. And the next morning I said, you know what? I'm going to drop you guys off. You guys do some stuff. I'm going to come after lunch. I'll go back to the hotel. I'm going to clean up our room and all that. My kids aren't good at folding their clothes. And I travel for a living. So I get to a hotel room. At any point you walk in, it looks like I just got there. It's all clean and perfect, not a mess. So I said, I'll go to the hotel. I'm going to clean things up. I want to relax around the pool, just hang out around the pool. and I'll come back and I'll meet you guys, and I'm just going to spend half a day there. And it worked out great. They understood. I understood. We all loved it. I was there for all the big moments. So in my kids' minds, if you talk to them today, they thought I was there the whole time. They don't remember that Daddy sat out on this ride or this ride or this ride. And I did go on one roller coaster ride with my daughter, who was 8 at the time. So it was a kiddie roller coaster. The bar would never come down. So they allowed us to ride it just with the little seatbelt things. And they had a seatbelt extender. Big people and little kid roller coaster. I wish that one had a photo because it would have been hilarious. I would have bought it just to have it for the laugh. But that's what we did. We planned it beforehand and it was easy. I didn't want it to be a surprise at the last minute. I knew this would be coming up and it was no problem. And I didn't feel stressed or any anxiety, and neither did my family.
So you were able to have a good time with them. It just took a little bit of coordination, a little bit of communication, and a whole lot of, taking care of yourself.
Yeah.
So,
and
yeah.
I loved it. I enjoyed it. If I did not do that, I would not have enjoyed it, and I would not have been a happy camper. And we were driving back and forth across Florida. We have relatives on the Gulf Coast.
Gotcha.
Orlando's on the Atlantic side of it. So they would not have enjoyed sitting in the car with me unhappy. But I was happy. I was thrilled. I had a great time. It was a vacation for me, and they had a great time. And I had kidney issues. No one would have known it.
Yeah. My husband we live in Hawaii. He is not an outside person. I call him an indoor cat. And so, it took us, we've been together for 14 years. It took me a good many of those years to realize that he's an indoor cat. And I love to go to the beach. The kids love to go to the beach. He is not that way. And so having to kind of manage our expectations that the beach brings me joy, him, it's not really a thing, but finding ways that we can compromise so that way it's fun for everybody. So nobody's feeling left out or feeling, like it's a waste of time. But it makes all the difference in having that communication and kind of setting those expectations ahead of time while also being flexible that you really don't know what's going to happen. It could, being in Florida is hot. So doing the best you can to plan and prepare ahead of time while also just like keeping those lines of communication open are just absolutely awesome.
Yeah. And at least for me, and we're all different, dealing with these invisible symptoms and challenges is just like our diets. We're all different, and that's okay. I found communication, and I over communicate. You guys, I'm sitting here sharing my whole life story for the whole world. But I found that the communication, at least with my family and the people I'm going to be with, has been so helpful at them understanding. When I go and I visit my wife's sister, we go and we visit her. She's about 1.5 miles away from us. When we go there, she's not trying to give me a whole bunch of cranberry juice to help my kidneys. She understands that doesn't work. He likes water with a little bit of lemon.
There is a very vulnerable component, though, too, to saying, well, thanks for the advice about the kidney juice.
Cranberry juice. And everyone out there has heard this. They all have heard it.
It's that nod and wave. Oh, thank you so very much. I haven't heard that information before ever. Thank you.
I so want to do this. I so want to go like, oh, cranberry juice. I haven't thought about that. I bet you that works. I so want to do that, but it'd be kind of mean.
A little bit. I would laugh, but.
I think it would shock some of the people if I did that, and they would think like, yeah, I've heard it'll help. It'll make you pee. Your kidneys will be better. But that's actually part of this invisible symptom is, kind of going back to the beginning, that's part people don't understand it because it's not, especially with kidney disease, chronic illnesses aren't spoken about. We don't hear about it.
Mm-hmm.
There's not a lot of, advertising or commercials on TV talking about it. Even TV shows, it's very rare for them to bring in a character and represent any of these issues. There's a TV show right now, Be Positive. Yeah, it's okay. It's a comedy sitcom. It's not realistic at all. There was Good Girls. Oh, great show. But they had a child with kidney failure, and somehow a week later had a brand new kidney when her mom got $10,000 and just handed over the cash. But just a few movies. One More Thing. That's the only one I can think of that had brought kidney disease and some of the challenges of it to the light. It's just not talked about at all. So there's no education, so little awareness out there about it, which amplifies these challenges we have internally.
And the depictions, like you had mentioned, even if there are people living with these, conditions that are depicted in these shows, it's often not accurate. I can't tell you how many times I see people doing CPR and then they just sit up like, this is great. And that's, working in the ICU, when you see someone doing CPR, they don't just sit up and smile, afterwards. So it's hard, I think, too, if not having that accurate representation and that regular, representation, so where we can actually say, wow, that makes sense, or I can understand that, from my perspective, not living with that disease. So raising awareness is huge, absolutely huge.
Yeah. Now you have a blog post about this, has so much more than what we've discussed today. When does that go live on your website?
It should be live now.
Awesome. And there's your website.
Yes.
Is it hanutherapy.com?
It's Honu.
Honu. And tell us a bit about how you picked that name. We've got a few minutes.
Yeah. So Honu, they are, it's the Hawaiian word for sea turtles. And the Hawaiian sea turtle, it's revered, very, very strongly as being a wise, gracious, go with the flow kind of creature. It represents like good luck and longevity. And I've always just thought that it's just such a beautiful representation of what I think we're all trying to do in our lives. We want longevity, we want a little bit of good luck in there. We're all trying to seek out this wisdom and this guidance. And it's just such an accurate and beautiful representation, I think, of the work that I'd like to do, in my community, the work that I've been doing, for my own personal life. And I just felt right. And it also helps living, in Hawaii, where it's like 83 degrees right now in January. So I know that nobody on the mainland is feeling sorry for me right now.
I got like 3 inches of snow outside right now.
I went to the beach this morning, so I know nobody feels bad. I know.
So the people in my neighborhood have been talking online a lot about an increase in our cost of electricity and heating here where I live. The power company apparently raised rates a little over 22% as of this month. And I'm sitting there thinking, like, maybe we need to move out of this cold climate someplace. I'm thinking Florida, someplace where it's warmer more often and doesn't fluctuate as much. And it snowed last night. We got snow everywhere and ice.
I'm from Chicago originally, so I know about the snow and the ice piece. I don't miss the snow and ice piece. I miss, my loved ones back home, but that's about the extent of it.
Well, I don't think you're getting any sympathy for living in Hawaii. It's a wonderful place. Though I have visited and I know the cost of goods can be challenging. You get some sympathy there.
I'll take it, but I recognize that I don't deserve sympathy for going to the beach this morning and reading. So.
Well, I look forward to doing things like that sometimes. And look, there's Pat says, "Come on down." She's from Florida. Yeah, we got a few other people here from Florida. I'm seriously looking at Florida, guys, in my future. Don't know when, but I'm thinking warmer weather, beaches will help my kidneys.
Get you a nice tan.
Yes, I definitely need a tan. I'm the guy who is extremely white all year round. And in some of my videos,
Do you burn and then
there's
just go pale
red.
again?
There's red underneath here. It is a burn and then white again. In some of my past videos, people may notice, they may say, you looked a little tan. That was a filter, guys. And I stopped doing it because it doesn't know the difference between your skin and your teeth. They didn't look pretty. All right. Well, I want to thank you so much for being back again. This was a great conversation. It's a serious conversation. This is something that, we have to deal with. I like to also, communication is big, but I also like to use humor to deal with things. Like if I can't change something, I'm going to laugh at it. And I find that helps me kind of deal with things, when it's appropriate. A lot of these communication is very, very key to helping deal with either yourself, if you want to communicate with your doctor or someone else, feel free to ask for help. If anyone out there wants to talk to somebody, things get a little tough on you, reach out to me. I'm here. And there's other help out there. I would be glad to help you guys find some help. But again, thank you so much, Lana, for being here. This has been great, and I look forward to our next show. And I want to thank everyone out there for watching. This is the last live show for this week, so I will see everyone next week in the next video. Bye, everyone.
Bye.